Well, being a top 100 hospital is really I think of it as a sort of a symbol of good housekeeping. It's a symbol of functioning at the highest possible level in cardiovascular services. I mean, when you think about it, there's lots of different rating systems for how a hospital functions, how a hospital does. Some of them are based on reputation, some are based on very soft facts. Top 100 is completely fact-based.
The Top 100 is not an award you can try to get. They get you. It's public data that this company searches through and finds the best hospitals in the country.
This Top 100 rating organization looks at all the different cardiovascular hospitals in the country and determines which are the very best.
It's not something you can apply for. It's not something you can buy your way into. It's a private company that wants to get this information out to the public so they know where to go for heart care.
It's based on a number of different criteria, and you could sort of lump those into some broad categories. The first, of course, is the mortality rate.
They look at our volume of patients.
It's also based a lot on complication rate.
They look at things like length of stay.
How we function as it relates to something called CMS measures.
Another thing they look at is the cost.
They make these criteria, and we function at the very, very highest levels as it relates to those particular criteria.
People in our area know that Rochester General is the heart hospital. They know it's the place to come to get your angioplasty, to get your cath, to get your bypass.
If we're ever going to solve this healthcare crisis, if you will, then all of us need to get together and say, okay, the only thing we should really be looking for is highest quality and best value.
You know, we don't do it for the awards. The awards, fortunately, come to us. Our focus is on taking care of patients, and we really feel that if we keep the focus on the patient, if we do a good job taking care of the patients, all the other things fall in place.
To make Top 100 once or twice requires the functioning of a team. To make it 8 or 9 times requires more than just the functioning of the team. It requires the team to have a certain attitude about it, and that attitude has to be nothing short of perfection. So we don't think to ourselves, you know, how are we going to do this today to be pretty good? And we don't think to ourselves, well, you know, we're as good as the hospital down the street, or we're as good as another hospital across the country. The only goal we shoot for is perfection.
I think the important thing is what it means to the community. It means that right here in Rochester, New York, we're amongst a group of less than 20 hospitals in the whole country. Our company is Cleveland Clinic, Mayo Clinic, Johns Hopkins. I mean, places that people know nationally. Right here in Rochester, you can get that same kind of care.
You know, you make lots of decisions in your life about how you want to function, and we made a lot of decisions 15 years ago and 20 years ago that are now being validated as being important, not just at Rochester General Hospital, but across the country. And it's possible that those decisions that we made 15 years ago could have been wrong. And so it turns out they weren't, and that the idea of team and perfection and continuously trying to improve what you do, that's paid off for us.